lovely viewers. Welcome to our YouTube channel. My name is Beatrice Chogali and I'm here with my fellow panelists. Today we are here to discuss some of the problems facing Ghana's health sector, and then we'll probably discuss some of the solutions as quality assurance consultants to curb these problems. To my right, I have here with me Okay, so one may ask, what is total quality management? Total quality management is an approach, is a management approach that is used to improve upon the quality of an organization. It involves all employees in an organization coming or working together in order to improve the organization's quality in terms of their products, services, or processes. So I would like to ask my panelists, what are some of the problems that we think we are facing in our health sector, taking maternal health care or childbirth into consideration? Okay, Sonia, can you help us with some of the problems we are facing?
Thank you for the question. That's actually a nice and interesting question. You know, in Ghana, we take everything for granted because initially we call ourselves black men. So recently there was a visit to the regional hospital, that's Greater Accra Regional Hospital. They had poor infrastructures. Actually, their theatre was very terrible that they even had to use torchlights for an operation. That's a CS operation. Which was very terrible because viewing from the upstairs theatre down on the theatre table, the woman was actually in pain. You could see that the surgeon, he couldn't see, so he was just cutting in part of the body, which was very terrible. So right now in Ghana, we are really facing poor infrastructure based on our theatre, especially these local centers. Because of that, most of people in the rural community don't want to visit the local centers for delivery. They rather have the traditional way of being at home and giving birth, which also leads to the death of the baby and also the mother.
That's very bad. Crazy. Did you have anything to add?
Yeah, one thing I would like to address is how the patients are approached or attended to, the pregnant women. You go to these hospitals around our community or maternity centers, then you find that everyone shouting on these pregnant women, insulting them. I feel it's very bad. It's very, very bad. Because imagine someone close to you in such a situation, being insulted whilst in pain. It's very bad. So I think we should also check that.
That's also true. Frederica, did you have any other problem you'd like to show light on?
I also talk of inadequate birth in most of the hospitals. Just recently, that was last week, I took a friend to the hospital. Guess what? It was very, very bad. There were not enough beds for her to lie on, which she was lying on the floor. It was very, very bad, and it's not a good thing to be practiced in the hospital.
Yeah, that's true. I think we should look at that. Okay, please, do you think there's any example problem you'd like to?
Yeah, to me, one of the major problems is lack of trained and well-qualified personnel in the labor ward. That is, for example, that was 2 weeks ago. I took a friend of mine to the hospital. She was in labor. When we got there was only one midwife in the whole general hospital who was taking care of like 6 or 7 women who are in labor. And she has to attend to one. After helping her with the delivery, she has to attend to another one. So my friend has to wait for how many hours, for how many long, before she will finish with them to come and meet her. If she's going to die, then maybe she will die before she can even attend to it. And I think this is one of the problems we have to look for and solve it.
Okay, so with all that being said, as total quality assurance consultants, what are some of the problem solutions you guys think you can recommend, or what are some of the principles or fundamental principles you think we can apply in solving these problems that we've spoken about?
Okay, so for this problem, there are very much a lot in Ghana. You can't solve all. Because there's no action space that are knowledge, right?
Yeah.
But the government just they don't care because initially most of them fly outside the country for the healthcare. So to me, from my perspective, I think the government should standardize the maternal health protocols for our mothers and our future children. Because we as women, one day you don't know, it's not a person who might go outside the country and give birth. You might also be in the country and give birth. So as a country or as Ghanaians, we should develop and implement standardized protocols and guidelines for the maternity health care, which will ensure consistent and evidence-based practices across all healthcare. So this one is just basic something. The government must put structures or must put guidelines in place so that we know that when someone is going to give birth, there are these protocols we have to follow, there's these guidelines we have to follow. For example, the Ministry of Health could just establish national guidelines for antenatal protocols, delivery protocols, and postnatal protocols, which will also provide the best healthcare providers for the best practice for each stage of pregnancy and childbirth in our country.
So please, you also have any?
Yeah, to me, to my suggestion, I think strengthen the midwifery workforce by increasing their supportive supervision, providing proper conditions for them, improving midwifery training and education can also help curb this kind of problems in our health sectors here.
Okay, with me, one thing I think can help us achieve total parity in our maternal centers is establishing maternal quality indicators. Ghana can define and track specific quality indicators related to maternal health care. For instance, the Ministry of Health could measure indicators such as maternal mortality rate, infant mortality rate of cesarean section, and adherence to recommended prenatal screenings. By monitoring these indicators regularly, healthcare facilities can identify areas for improvement and take appropriate actions.
I also add up by saying engaging the community. Ghana can engage community. Ghana can encourage community, engaging and practicing in maternal health care, for example, establishing community-based support groups for pregnant women and their families can provide education also, emotional support and guidance throughout the pregnancy and childbirth journey. These groups can also serve as platform for sharing feedback and suggestions for improving the quality of care.
We also talk about the quality assurance audit and accreditation. So Ghana as a country can also establish some quality assurance audits, meaning that when we have weak auditors, we must get auditors who go around to the hospitals to check our antenatal, our maternal health care unit for our mothers, to check the quality, to check the protocols that they put in place, whether they are working on yours, to check the qualifications of most of the midwives. Most of the midwives, they just go to school, once their parents force them to go to school, they just go, they study, and at the end, nothing comes out. They go to the hospital like they don't know what they are doing. So I think then as a country, we must also make that also happen, because that's also going to save us in the future. Because you don't know who wants to be the next president, as they always say. So if we have these things in place, I'm not sure we'll be having a lot of deaths on our hands.
Okay, so I would also like to chip in that as quality assurance consultants, we can also enhance communication and information exchange in our health sector, that is the maternal health sector. We can implement systems to improve communication and information exchange between healthcare providers and then maternal health care. For example, the Ministry of Health can bring electronic materials that we can use to track every patient's name, their health problems and all that, so at least when a patient who is pregnant attends the hospital, you will be able to know that, okay, this person has a previous history of this disease and this disease. That way it would help in reducing mortality, and then at least it will also help in knowing the right medicine or diagnosing the right medicine for the pregnant mother in order to save the life of the mother and then the baby during delivery.
Okay. So I think implementing maternal safety initiatives can also really help. Ghana can prioritize maternal safety by implementing initiatives such as the use of checklists during labor and delivery, conducting regular safety drills, and promoting a culture of reporting and learning from near-miss events. By focusing on patient safety, healthcare providers can minimize risk, prevent adverse events, and ensure a safe environment for pregnant women and their newborn babies.
Okay, we've all stated good solutions and non-solutions. So we'd like to conclude by saying that by implementing these examples and then adhering to the fundamental principles of quality management, Ghana can make significant improvements in the health sector, specifically in pregnancy and childbirth care. Continuous evaluation, feedback and improvement efforts are essential to ensure sustained progress and ultimately provide better health outcomes for pregnant women and their newborn babies. Thank you. Thank you, my lovely panelists, and thank you to my lovely viewers. I hope you like, share, and subscribe to this video.